Elizabethan collars?
Yes, okay. And these are not the best,
Yes.
like there's some better Elizabethan collars. These collars are meant so that when you put it on the dog, their head is out here, it's the cone of shame. And it's meant so that if they have surgery or if they have an injury of some sort that you don't want them to be licking or chewing, it's meant so that they can't reach it. And I'll use Jackson as an example. So these collars typically come to us like this, and they have to be, you have to give it something so that it doesn't slip off the dog. So that's what these small tabs are. These tabs go in at the top. And this makes the place where you can attach it. There. So this then becomes like your little belt loops. Yeah, I know, that's for you. You're gonna wear it. And you can either put their collar through it, or I have some tie gauze that we usually put through at the clinic. And then there's little notches, and I'll leave this with you too. There's little notches that are on here as well that you just have to feed this tab through. I'm gonna make it small enough to fit his little head. And this takes a little bit of skill to get it just right. But once you get it figured out, it sticks together pretty easily. So then, she's like a shepherd mix. They've been together since she was a puppy. She stays at our house all the time. So now I have cone of shame with my belt loops that I can either feed a collar through, or if they don't wear a collar, you can tie with anything. Like sometimes at the clinic we'll use fabric, because we put bandanas on some of our pets when they go home, and we have little strips of bandana material that we have left over. So this then becomes my little tie that I can tie around the dog's neck. Jackson. So these just slide over their head. Like, oh my gosh, what did I do? Hold still. So it slides over their head, and then you just tie it to make it stay. Or if they had a collar, which he doesn't wear one, but if they had a collar, you could just slip it through there, and that keeps it from coming off of their head. But now they can't, oh no, you're mad. It's okay. So now he can't reach anywhere to either tear out sutures, or if he had an eye injury, he can't paw at it, so he can't get to what we're trying to keep safe. Good boy. Okay. Yep. Here you go. Okay, so there's that one.
On the second page there, about a third of the way down, it has the list.
Oh, right there. Okay, great. Okay. I wasn't sure what a tail tie is.
That might have to
has
do with the
something to
horse
do-
thing.
Yeah.
Horse. Okay, good. Okay, not me. Okay. Okay, so bandage removal. Do they give y'all scissors and stuff too? Do you actually have to do it?
Katerina,
Yes.
Cassandra. Okay.
You do have to remove it. So they
Yes.
give you
They'll-
specific bandage scissors.
Okay, they'll probably give us regular scissors or like a smaller pair of bandage scissors. They're not
Okay.
gonna give us like, well, I guess bandage scissors aren't too big. Maybe.
So if you look at these are bandage scissors. So they have a blunt end on them.
Oh,
and
you're right.
that's
That'll
what
be
they're,
fine.
yeah, so this is what they're made for.
Yeah.
And I can get a pair of scissors for y'all. These are I borrowed from one of my friends. So this is meant so that it can slide underneath the bandage without cutting the dog. So see how it has a little blunt end on there. So that, come here, you. I know. Like, oh gosh, you're gonna rip my hair off. It's all right.
He's like, I know what happened.
I'm like, great, lady. Wait a second. This is not what I signed up for. I want to be here today so I can play with my friends.
Baby.
Come here. So when you're taking off the bandage, you have to keep the blunt end, no, you're not gonna say no, the blunt end down, and it just slides underneath that bandage, so just like that, okay? You want to try and stay on the outside of their leg. Stay. So it's gonna go under like that. The inside has not as good of a space to get the bandage scissors in, so it's better if you go on the outside. The other thing too is sometimes if they have a catheter in their front leg, you don't want to go on the very front of their leg. You just want to go on this side, and you're just cutting. I don't know if you can see that. And that cuts the entire bandage, and then you can just peel it off in one piece. That wasn't bad.
He's like, what was
And I'll leave this with you as well.
Thank you.
Bless you.
Okay, and then, any questions on that? No, good on that? Okay. Okay, applying ophthalmic medication, and I think I saw, is there ear medication, yeah, okay. Sorry, y'all. So, this is just a, lubricating eye ointment, Jackson. He's like, crap. Come here. Got it, other guy. Come here, see, come here.
Nickname.
Yeah, yeah.
Oh.
I know, you're Hey, so, okay, cute. So when you're doing eye medications, it's hard to hold the eye open and apply medications, but if you can pull the lower lid down, see how that exposes the bottom, the conjunctiva? So that, you're gonna lower the eyelid down and it opens that eyelid up so that you can apply medications, drops and or ointment. So, stay back there. I know, good girl. Stay. So if you lower the eyelid, here, come on. Hang on, stay. Lower the eyelid down so you expose the conjunctiva. You just put the line in that, so you can see, in the conjunctiva, and then it'll rub around either a drop or the ointment. What is that? You're okay. You're okay. Yeah, now you're coming out. I know. Let's see. When you're doing ophthalmic medications, don't touch the eye with the ointment and or the medication, the bottle or the ointment, because you can transfer infection from one day to the next. If you're treating an eye infection, you want to make sure that you are treating it, cleaning the tip, and then reapplying the next day or that evening if you have to do twice a day. And so that's the only important thing about that.
When you do an ophthalmic medication for a cat, is it similar?
Similar, yes. Cats tend to take two people because somebody has to hold and maybe wrap in a towel. It's better for cats, it's less stressful if you wrap them in a towel, make them into kind of a burrito, and then somebody holds and then the other person applies the medication. It's just too stressful on some cats to hold them down, open their eye, put the medication in, and cats aren't typically as willing participants as dogs are, so cats usually take two people. And some dogs take two people too, and we have people that can't do their own. They have to bring it into us and we do them at the clinic just to apply medication. So it happens too. Okay, who wants their ears done? No? Okay. So same thing on the ear medications. This is just an ear wash that I'm using. The eardrum, the way a dog's ear canal is, it's shaped like an L. So there's no way, the eardrum is down here, so there's no way that you are going to be able to reach the eardrum or injure it with a typical bottle of ear medication or ear wash. The goal for any pet owner is to get the medication in, massage the ear, and then take, even a regular Q-tip is not going to not be able to reach the eardrum itself. But you can take a gauze pad, wrap it around your finger, and then clean out the ear, or a cotton swab. Typically, we don't have the owners sticking Q-tips in their dog's ears, but using the gauze pad or the cotton swab works just fine. Some of these medications, though, and or ear washes don't require you to remove it. Jackson, come. So like this one, you put it in and you massage the ear, and then they shake leftovers out, and then you don't have to do anything with it. It's meant to break down the wax in the ears and treat any infection, yeast infection or bacterial infection in the ears. And you're welcome to look at your own dog or look at Sadie's ears. You're gonna come out here for a second. There you go. Now you wanna come see? So, most dogs are not willing participants, but this is called the pinna of the dog's ear, and then the ear canal actually goes in, goes down, and then in. So there's the hole to the opening to the ear canal is right here on the lower part of the pinna. You're just gonna put that bottle right there, squeeze some in, and then you're gonna massage that ear canal.